you can find this online actually if people are interested in looking for it. But it's basically, you know, the sort of Obamacare replacement. I should have this better organized, but anyway, take my word for it. There's a document that's out there, and again, it's not a bill. It's not been you know, marked up in a committee. We haven't really had any specific public hearings on it, but it is an outline that sort of shows the path that's going forward. Many of you, you know, I'm sure reading in the media or watching the news has seen already. There's been a lot of reporting since last Thursday when it came out. So I have a few slides which are just, again, are going to run through a couple of some of the features in it. The first is that the Medicaid program, which again has been around since the 1960s, that's a program to help lower income Americans receive health care, and it covers about 70 million Americans today. It's basically a program when you qualify for it, it's a guaranteed benefit that medically prescribed care, medically necessary care will be provided, whether it's prenatal care, maternity care, or long-term care in nursing homes. And as I said, it covers about 70 million Americans. It's actually bigger than Medicare, which covers roughly about 50 million Americans. Again, what the proposal does, and again, I'm sure many of you have seen this, but it basically changes the whole sort of approach to Medicare. It block grants the program as opposed to making it a guaranteed benefit for recipients. And what block grant means is that the state of Connecticut will get an allocation and all the other states will get an allocation, and then it's up to the state legislature and the governor to basically come up with a way in terms of how you're going to spend it, which is, remember that movie Sophie's Choice? I mean, it's sort of the healthcare version of Sophie's Choice, because states are really going to be forced to make choices about what kind of coverages they're going to provide, whether, again, it's nursing home coverage or prenatal coverage or heroin and opioid substance abuse, because Medicaid is actually a big program in terms of providing people care and coverage for treatment. And again, I'll talk about this a little bit more in one of the next slides, but it is a huge change. Christine Conley is here, state representative from Groton. I don't think you have to wave your hand there. I wouldn't wish block granting of Medicaid on my worst enemy. And again, I did these budgets when I was in Hartford. As some of you may recall, I was chairman of the Public Health and Human Services Committee. I did Medicaid budgets back in the day. And this is really just a very drastic change in terms of the program. And that's included in the proposal. It also repeals the Affordable Care Act subsidies that are based on insurance and substitutes it basically with a tax credit that is based on age and not income. And as somebody said, you know, so Warren Buffett, or somebody in their 50s, you know, let's say Mark Cuban, you know, the big millionaire bastard, he would get the same tax credit as a person of the same age, maybe a single mom who's in their 40s, as someone like that. Again, it's totally decoupling from an income-based subsidy program to an age-based one. And it also, again, lays out a proposal for ending the tax exemption for health insurance. Again, there's a Cadillac tax in the Affordable Care Act, which I've been a staunch opponent of, and we pushed that back to 2020. This would basically cap the tax exemption for health plans. You know, when John McCain campaigned for office in 2008, he would have capped it at $5,000 for an individual plan, $10,000 for a family plan. Anything above that would be treated as income that people would have to pay tax on. So that's a tax on the person who owns the health plan. Again, these are working age individuals. So so that was, you know, the layout that's there, and you know, the plan is for next week to have Energy and Commerce and Ways and Means to start doing actual markups, as we call them, in Washington. During the recess this week, the Congressional Budget Office has taken this proposal and they're crunching the numbers, and they're going to come back in terms of budget impact. This afternoon, my office got a call that there's a lot of talk now that this thing is going to get pushed off beyond next week because the CBO scores that are coming back are frankly problematic. Let's put it that way. So, so in any case, you know, that's sort of the state of play in terms of his proposal, and we can talk a lot more about some of the other features in terms of pre-existing conditions, lifetime limits, etc. So we'll go to the next slide. which again, just as a quick catch-up in terms of where we stand today, in terms of the latest enrollment at the exchange and through the Medicaid program. In 2012, the state of Connecticut, the uninsured rate was 9 point, these are from Census Bureau data, by the way, 9.2%. Today, statewide, it's 3.8, and then you can see what the second congressional district is. I'm proud to say that we have the lowest uninsured rate of the 5 congressional districts, and again, that's because of a lot of hard work that happened on the ground. Otis Library, right here in Norwich, had enrollment sessions. I visited a lot of those during the time that we were starting up the exchange. United Community and Family Services, which is the local federally qualified health center, UCFS, they also did enrollment. Backus Hospital was part of that process. And again, it was a lot of teamwork on the ground that sort of got us to that place. Next slide. So this year, the exchange just completed its enrollment. And again, as you can see here, almost 112,000 residents signed up for what's called qualified health plans. Those are either the Anthem Blue Cross or Connecticut plans that are sold through the exchange. Interestingly, the average age of enrollees dropped from 39 to 35. That's actually a pretty significant data point because you hear a lot of talk about the death spiral in the Affordable Care Act, and the death spiral basically should mean, and the American College of Actuaries tell us this, is that basically younger people would be exiting the program and would be leaving an older, sicker population in the system. So, that certainly is a rebuttal to that, at least locally here in the state of Connecticut. Again, 77,000 get their coverage through Medicaid expansion. The law boosted the eligibility for all adults. And that's obviously been a big part of the story about how we got the uninsured rate down in the state of Connecticut. And again, another about 25,000 kids are on their parents' health plan, like my daughter Elizabeth. So she's one of those. And so, when you sort of combine all those factors, as well as the fact that the economy has improved somewhat here in the state of Connecticut, and more people are getting their coverage through being hired, whether it's an electric boat or other places, that also has contributed to that downward trajectory. Next slide. So again, going back to the block grant, we had a meeting with some pretty extraordinary group of healthcare stakeholders in Washington. The Connecticut Association of Healthcare Home Providers, the nursing homes, and I think I saw Matt Barrett, who's here, who represents some of the nursing home providers here in the state of Connecticut, the Connecticut Hospital Association, and the Connecticut State Medical Society. And they make it very clear that what I said earlier about the change in Medicaid going to a block grant is a really very, I would call it radical departure from the system that's there in place. Again, no one, the existing system is not the 10 Commandments. It needs a lot of work, as Matt, I'm sure, would attest. But to shift this to a federal, from a guaranteed benefit to a block grant, is something that really healthcare stakeholders who deal with the system day in and day out have come together as a group to really put up the warning flags. Next slide. And again, ARP, we've got some folks here from ARP who also, again, has come out in terms of what they think the impact would be on seniors and people even age 55 and up. One of the interesting things about the Affordable Care Act is that providing an avenue for some folks from age 50 to 65 to get affordable health care has actually been a good thing for Medicare, because for a lot of people who fell into that age group before the Affordable Care Act, they were putting off medical visits and treatments, and by having a medical home where they were getting checkups and getting conditions caught earlier, we're actually seeing a healthier population entering the Medicare program at age 65. Again, I don't think anyone's done a really sort of black and white study in terms of that, but you talk to people who are in the field, they will tell you that's in fact the case. And that came up at our meeting the other day with ARP folks. So I think that's all our slides, right? And yep, we are. So, and again, this is not going to be concentrated solely on the Affordable Care Act, but as I said, this is a very, we're going back into town, and because of the way the budget resolution was done, this is an issue that I think is very much relevant in terms of the questions and the calls that we're getting in our office. Again, if you break out the percentage of that boost. I mean, a lot of this is based on people who are asking a ton of questions about what this change could mean for their health plan and their health insurance. I will say this, as I said, the Affordable Care Act is not the 10 Commandments. I mentioned earlier the Cadillac tax is something that I've actually been a leader of in terms of, I think it really was a negative policy in terms of employer-based care. I think we could have more choice in the exchanges. When we passed the bill in the House, some of you may recall, we had the public option, which was, again, an option to give people another alternative in terms of buying insurance. The Congressional Budget Office said that if we adopted the public option, it would actually save money for the system, and if anyone has any questions about that, we can supply them with that. I think actually buffeting some of these premium increases with programs that exist in Medicare called reinsurance would also have really helped a lot this year in terms of some of the insurance premium increases that we saw coming through the system. So again, as I said, 6 years ago when we were going through this process, when the Affordable Care Act was being debated, our children and grandchildren will debate healthcare. It's a dynamic sector. There's a lot of change in terms of new treatments and therapies, and public policy is always going to be catching up with that and making changes, like Medicare, which has been amended 50 or 60 times since it was first passed in 1965. But to do a repeal without any kind of really incredibly vetted and thought out replacement is very destabilizing, and I think will take this country backwards in terms of the protections that that law has provided for a lot of people who have voted with their feet in terms of the way they've enrolled in the system. So again, thank you all for being here. By the way, are there any paid protesters or people that are here tonight? Raise your hand. Okay, anyway, just kidding. So yeah, we here. So with that, okay, we've got mics on either side, and again, what I would just say, we got a lot of people here. You want to make a statement, I have no problem with that, but if you could kind of keep it somewhat succinct, so we got basically a hard stop at 8 o'clock, and let's open the floor.